Okay. Hello, my name is Kareli. I'm gonna be your nurse practitioner today. Before we start anything, I just wanted to get your consent for recording this and uploading it to YouTube for my professor to watch. You
Okay.
agree?
Yeah.
And then I'm gonna perform her hand hygiene. Today I'm gonna be doing a musculoskeletal exam on you, which means that I'm gonna be checking most of your muscles and your joints. Okay, so the first thing that I'm gonna do is I'm gonna take a look at your hands, and I'm just looking for any deformities, any swelling, any redness, and none is noted right now for this patient. And then I can proceed and palpate. I'll palpate the interphalangeal, proximal and distal interphalangeal, and the metacarpopharyngeal for any tenderness, any nodules, any swelling, which are non-noted. Then I can proceed and tell the patient, can you evaluate range of motion? Can you make a fist? And then I'm watching the movement. It should be symmetrical. And then I'm gonna ask you to put your hands back to normal, and then extend, and then flex your fingers. Okay, and then put them back to normal, and then abduct your fingers, and then adduct. This means that the patient is full range of motion to the hands and fingers. Now I can proceed and I can do the wrist assessment, which means that first I'm gonna be looking at the wrist for any abnormalities, any redness, any nodules, any swelling, which there is none noted. And now I can proceed to palpate the metacarpals and the wrist bones for any nodules, any tenderness, and any swelling, which none is noted. The other thing I can do is check the patient's range of motion of the wrist, which is gonna be flexion, extension, and then it's going to be internal, and then external, which is the radial and the ulnar deviation. And now I can do the special test, which is going to be the Tino test, which is for carpal tunnel syndrome. And I'm gonna ask you to do your hand like this, and I am gonna tap on the median nerve with my middle finger. Do you feel any pain or numbness in your fingers?
No.
And I do that for the other hand, hyperextending the wrist and then tapping on the median nerve. Do you feel any tenderness or numbness?
No.
So that will be the Tino sign or Tino's test. Then I can do the Fallon test, which is I'm gonna ask the patient to do the hands like this and press them together. And I'm gonna be, patient has to hold this position for 40 to 60 seconds, and we are gonna to assess for tenderness and for paresthesias in the fingers. Do you feel any pain, any numbness to your fingers?
No.
Okay, so that is a normal finding, which means that the patient doesn't have carpal tunnel. The next thing I can do is gonna proceed to the elbows. I can look at both elbows, and I'm looking for any nodules, any redness, any swelling, and then there's none noted. Now I can do the palpation, which is palpation of the olecranon, looking for nodule, swelling, or tenderness. And then I can also palpate the medial epicondyles and the lateral epicondyles for tenderness or nodules. The medial, if there is tenderness on the medial epicondyle, is for tennis elbow. And then if there's any tenderness on the lateral epicondyle, it means that it's pitcher's elbow. The other thing I can proceed to is the range of motion of the elbows, and I'm gonna ask you to extend and then flex, and then I think that's it for the elbows. So flex, extend, and that will be the normal findings on the elbow. So full range of motion to the elbow, and then now I can proceed and I can do the shoulders. I'm gonna ask you to stand up for this one, and I am looking at the shoulders symmetry, that it's not higher than the other. There, for the purposes of this video, I'm not gonna have my patient take his shirt off, but usually we will look for any nodules, any redness around the shoulder areas, in the side and bilaterally to the front and to the back, which there is no nodules, no tenderness, and then the symmetry, making sure there's no one shoulder higher than the other. Then I can proceed and I can palpate the shoulders and look for any nodules or tenderness, which will be the acromioclavicular joint. And then I can also palpate the coracoid and the this part right here that is called the humeral humerus, the greater tubercle of the humerus, and that is normal. There were no nodules, no tenderness, no swelling. And I can also proceed to the range of motion, which means that the patient is gonna I remember. So it's up, and that is flexion, and extension will be, and I will be holding the patient's scapula, and then you can relax. We can also do, so the flexion will be at 180 degrees, and then the extension will be at 60 degrees, and that will be a normal finding. Then the patient can also abduct the arms, which is that he's gonna be lifting them to the side and then putting back in. And you can also do a duck, which is doing this, and then the other side, and then I'm comparing side for range of motion. And then I can do internal rotation, which is scratch your neck, and then the other side. And I can also ask the patient to do the external rotation, which is with this hand touch the opposite scapula, and I will evaluate to see if that patient is able to do that, which he is, and do it with the other hand, please. Okay, and now I can proceed and do a specialty test, which will be the last part of the shoulder examination. Put your hands forward, and then I'm gonna do the empty can test, which means that you're gonna simulate that you empty a can, and keep it that way, and then don't let me push the arms down. And then I'm looking to see if there's any pain with this, which there's none. That will mean, if there's pain, that will mean that it is there's a tear in the shoulder. Rotator cuff tear. Then I am done with the shoulders, so I can do the neck. And the neck is, first of course, is gonna be inspection, and I just see for symmetry of the neck. And I can also check the back part of the neck, and see if there's any nodules, any redness, any asymmetries, which this patient has none. I can proceed and palpate for TMJ, which is a temporal mandibular joint, and I'm gonna place my fingers here. I'm gonna ask you to open and close your mouth, and I'm looking to see if there's any tenderness. Do you have any pain when doing that?
No.
Okay, so that is a normal finding. And I can also palpate the muscles that are in the neck and the cervical area, which is the sternocleidomastoid right here. And I can also do the cervical spine and then the cervical muscles. Maybe you can turn around. Oh, so the cervical spine and then the cervical muscles, and we can also do the rhomboids, which is right here, and the trapezius. And I'm looking for any tenderness, any pain, which there's none noted right now. And you can turn around, please. I can do range of motion of the neck, which is chin to chest, and then look up. So flexion, extension, look back to the middle, and then rotation to the right, and then to your left, and then lateral is ear to your shoulder and ear to your shoulder. And also we can do the opening of the mouth, open as big as you can. And a normal finding is the patient can put up to 3 fingers of his own hand, and that will be a normal finding. The other thing I can do is check the jaw movement. Can you open your mouth and move your jaw to the sides? And the patient is able to do that. So that will mean that range of motion is full to neck and jaw without any abnormalities. Then I can proceed and I can do the patient's feet. So I can do, can you sit down please? Bueno, lay down maybe? Hold on. Okay, so I'm going to look at the patient's feet. I'm gonna check for any bunions, any corns, any swelling, any redness, which there is none noted. And also I can look and see if there's any calluses, which there are none. Now I can proceed and I can palpate, which means that will palpate the distal and the proximal the joints of the toes. And I can also do the metatarsals. And for palpation, I can also palpate for Morton's neuroma, which will be abnormal finding. And then for plantar fasciitis, which is pain. And then for tenderness, any masses, and there's none noted. And then I can also check the patient's range of motion of the toes. Oh, the other thing I can look is at the arch of the feet, which will be observed easier when the patient's standing up, to see if the patient has a flat feet, which patient does not have that. Now I can do range of motion. Can you curl your toes and then point them up? Okay, and then I can also do point them to the middle and then to the back, to the out. Perfect. So now it's shaking range of motion, and it means that the patient has full range of motion. There were no abnormalities noted. And then I can proceed to the ankles, the patient's ankles. First, I'm gonna look at the patient's ankles and checking the Achilles tendon and the parts of the ankles for nodules and any redness, which none are noted. And then I can also palpate, and I'll palpate the Achilles tendon. I can always palpate medially and laterally the epicondyles, and for any tenderness, any masses, which there are none. I can also do range of motion, passive. I'm gonna do movements with my hands, and then once I'm done, you can do them by yourself. Is that okay?
Okay.
Okay. So I'm gonna do the ankle like this, which is flexion, extension, flexion and tension. Can you do that? Flexion, extension, and then this flexion, extension. And then we can also do rotate the ankle and then rotate the ankle. Can you do that? So patient is able to do that without any abnormalities, and that is a normal finding. And that is the last part of the ankle, and we can do the knees. Can you no, that's okay. Actually, I'm gonna check the patient's knees, and first I inspect and look at to see if there's any swelling, any tenderness, any swelling, any redness, any masses, any nodules, which there are none. And I can also check the patient. I can palpate the suprapatellar part, and then the median, and then the lateral. And I can also palpate in the popliteal area for cyst, which is an abnormal finding, and this patient does not have that. And we can do range of motion of the knee, which is can you sit down for me, please? So you're gonna extend your knee and then let it down, and then the other one. And then you're gonna flex, like try to put them like that, and then the other. Okay, no problem. And then I can also do it as a passive, which there are no abnormalities noted. Which means that the patient has full range of motion to knees bilaterally. I also look for symmetry, and that is a normal finding. Now I'm gonna ask you to go back to laying flat, and I'm gonna do specialty tests of the knee, which is the valgus stress. Varus stress first, and this is to identify if there is a tear, which is performed by having the patient kind of like semi-relax the leg, and then grabbing from this side, and then putting resistance in, and looking to see if the patient has any pain with that movement. Do you have any pain with that movement?
No.
And I can also do it on the other leg, and it will be like this, trying to do it to the inside. So that would be the varus, and then the valgus will be the opposite, which means that I'm gonna be putting my hand outside, and then this one right here, and then I'm gonna do this, and that will be identifying if the patient has any meniscal tear. And the other test I can do is the Langmans, which is we have the patient bend the leg, and we gonna do resistance to it and pull, and we can also do it like this to see if there's any laxity, and if there's any pain, that will mean that is a tear as well. The other test we can do is a drawer test. I'm just making sure that I'm on the screen. So for this one, I will see on the patient's feet, and then I will pull on the patient's leg to see if there's any laxity, and then if the patient has pain, and I can also do it towards the patient. And this, if there's any pain, it would indicate that there is a tear as well, which in this case, do you feel any pain?
No.
So in this case, it's a normal finding. And then the last test for the knee is the McMurray's test, which is that I hold the patient's leg, and I can do internal and external, and I can do rotation, and there is no tenders noted, and that is a normal finding, and that is the McMurray's. Now I can do the patient's hips. In this case, normally I have to look at the patient's skin. In this case, for the purposes of this video, I'm not doing that. But of course, we're gonna be checking the hips for any swelling, any redness, any deformities, and also for how the hips are aligned. If one hip is higher than the other, which in this case is not, and then I can palpate. We can also see the hip alignment when the patient's standing up, but in this case I'm doing it when the patient is supine, and I can palpate the hip, which is gonna be the anterior iliac crest. And then I can also do the trochanter, greater trochanter, and then with the patient turning, I can do, can you turn? So I can also check for alignment of the hips right here, and we can also palpate the posterior iliac crest, and we also check the sacroiliac joint, and we check for any tenderness, any swelling, any nodules, which there was none noted. Okay, you can go back to facing forward. Now we can proceed and do the hip ratio motion. And again, I'm gonna be moving your legs, and then later you're gonna be doing the movement yourself. Okay. So I can do extension like this, and then can you do that? And then the other. We can also do abduction and adduction, and then to the other leg, abduction and adduction. Can you do that? And then, sorry, this one was flexion. Okay, this one was flexion. And then can you turn around? And then he can do extension. I'm gonna lift it. Okay, so this is extension. And can you do that for me too, please? Okay. So it's full range of motion of the hips, and what else is in this? Okay, can you turn again on your front? we can proceed and we can do, now that the patient's laying flat, I'm gonna do the straight leg test, which is for herniated discs, and it's part of the patient assessment of the spine. And it is, straight leg test means that I'm gonna lift the patient's leg, and a positive finding, which is our normal, it's if the patient feels pain around 45 degrees, then it's abnormal, and it can mean that the patient has a herniated disc. But do you have any pain?
No.
So this we can check for both sides, and the patient has a normal finding. The last step is one of the specialty tests is the Thomas test, which is that the patient flex, and you can do this, and then we check this special test to see if there's any abnormalities with the hip, and that is the Thomas test. And you can do the other leg as well. The patient will be feeling pain with this movement. Do you feel any pain?
No.
And that is a normal finding. And then the other test that I'm gonna do is the Faber test, and it will be to we bend the patient's leg and put it on top of the knee, and what we do is push towards the exam table. Do you feel any pain?
No.
No. And then we do it to this side as well. Do you feel any pain?
No.
Okay. And that is a normal finding. If the patient were to have pain, it means that that's an abnormal finding, and we'll have to further evaluate the hip for any injuries. The other tests we can do, we can proceed and do the spine. Can you stand up? And we're gonna move the camera. Okay. Okay. So one of the tests that I just remembered about the part of the neck, going back to it, is the Sperling test, which is checking for any cervical abnormalities. And I'm gonna ask the patient to look to your side and then to the ceiling, and then I will lightly push on the patient to see if there's any pain or any abnormalities, and then do the other side as well. And then this test will not be performed on a patient that's elderly or frail, or if a patient has a cervical injury, we will not be doing this test. And that is the Sperling test. When we look at the patient's spine, first we're looking at the overall posture of the patient. We also look from the side to see the curvature of the spine, to see that there are no kyphosis or lordoses. And from the back, we look for shoulder height, which will be symmetrical. And we also look for hip height. It should be at the same and symmetrical. And I'm not gonna look at this test today for the purpose of this video. I'm not gonna look, but usually we check at the gluteal folds, and they should be symmetrical as well. That's checking the overall posture of the patient. The curvature of the spine is smooth and normal. There's no abnormalities noted. Now I can proceed and I can palpate. We palpate all the spine and in the interspaces as well, to see if there's any abnormalities, any nodules, any tenderness, any swelling, and there is none. We can also do percussion with the ulnar part of our fist, and we can do it either this way, then this way, and this can help us identify if the patient has normality, maybe a fracture. And now we can do the range of motion of the hip, which is performed with the sitting down. Well, the first part is the bending over. Can you bend as low as you can, please? Forward. So this, I will check movement that is symmetric, that is not going one part more than the other. And I also check the spine to make sure there's no scoliosis. And this is the flexion of the spine, which is a good range of motion. It was a symmetric movement. We can also, the normal is that the patient is able to do it for 90 degrees, which is normal today. And then the other part, you can go up, and we're gonna do the extend, and we can, that's good, thank you. And we can provide support on the patient's hip. We can also do lateral to this side, and then to the other side, and then go back, and then rotate your shoulder to that side, and then to the other side. Perfect, that's it, thank you. So that is the range of motion of the spine, which is full range of motion. There are no abnormalities, no tenderness, no difficulties doing these movements. And for the specialty test of the spine, we already did the straight leg test. And I think that's the end of the musculoskeletal exam. Thank you so much.